Hello students. In the continuation of my first lecture of the Norma Basalis, in which I told you that this exterior of the base of skull has been divided into the three parts, anterior part, middle part and posterior part. Today we are going to discuss this middle portion of Norma Basalis. Clear? So, the middle part extends from the posterior border of the hard palate to the arbitrary transverse line passing through the anterior margin of foramen magnum. So, in my first class, I already told you how we divide. For the study purpose, you are having an imaginary line here, and this is the posterior margin of hard palate. So, this area which you are able to see here in between these two parts is your middle portion of Norma Basalis. Now, when you will see the Norma Basalis, you are having the two areas. So, for the study purpose, we will divide this area into the two parts. First is middle portion. So, we will discuss this area and then the lateral portion, that means these two areas. So, whenever you are reading the skull, you have to first read the middle features of this Norma Basalis, and then we will discuss the lateral sides feature of this second part of Norma Basalis. So, when you are discussing this middle area, what are the features you are going to see in Norma Basalis? So, the first thing comes is the Vomer bone. Now, whenever you are having the base of skull in your hand, you will find that there is a presence of the Vomer bone on the superior aspect of this hard palate. Now, my dear students, you have to understand that this you are seeing from the inferior side. When you will keep it in anatomical position, this is actually the base. So, it will come in the lower part and this is your upper part of the head. So, you have to understand that this is the posterior border of the Vomer bone and this is your upper part of the Vomer bone, and here comes is the lower part of the Vomer bone. Why lower part? Because you have to make it in anatomical position. So, when you will rotate it, what will happen? This is the Norma Basalis which is facing inferiorly. So, this is the Vomer bone, and in the midline you will find that there is a posterior border of the Vomer bone is visible. Apart from that, behind the Vomer bone, you are able to see a bone, and that is actually known as bar of the bone, which is broader in size. Now, this is the bar, this is known as bony bar. Now, when you will see this bony bar posteriorly approaching the anterior margin of foramen magnum. And this bar starts from the upper borders of the Vomer bone, which are known as ala. So, these are the two ala of the Vomer bone. What do you mean by the ala? This is the two wings, or you can say the in upper part, this Vomer bone splits into the two parts, and these splitting is known as ala. But you are seeing the ala here because you are seeing the bone in a reverse position. Clear? Now, this bony bar, if you will see this bony bar, it is formed by the fusion of two bones, sphenoid bone and basilar part of occipital bone. Now, this is the suture line which is visible in this image, but sometimes when you are having the dry skull in your hand, you may not find this line. Why? Because this line ossified. And this is a very classical example of primary cartilaginous joint. So, this suture line may be present, may not be present, and this is a junction between the sphenoid bone anteriorly and the occipital bone basilar part posteriorly. Clear? And this is the important area, and this area is known as broad bar of the bone. Now, what are the important bony features you will see in this area? So, in this broad bony bar, you will find a small elevation in the midline, and this midline elevation lies 1 centimeter in front of the foramen magnum. So, this is foramen magnum. Now, anterior to this, you will find here a small projection, and this projection is known as pharyngeal tubercle. So, this is a very commonly asked question in exam. You have the spotting, and you will have to keep this thing in mind that if somebody will put a mark in front of the foramen magnum on this midline bony bar, my answer has to be the pharyngeal tubercle. Now this tubercle provide attachment to the pharyngeal raphe, which is a part of the pharynx, and highest fibers of superior constrictor muscles. So for this you can go and refer my class where we have discussed the formation of the pharynx. So this is the one thing. Now the second important thing is that the vomer bone separates the two posterior nasal aperture, and these apertures are also known as choana. So when you will see the norma basalis, you can see that this is your hard palate. Now on the upper part of the hard palate, you are receiving a midline bone is the vomer bone, which is having the split areas in upper part, which are known as ala of the vomer bone. Now on both the side of the vomer bone, you will find the two openings, and these are posterior nasal opening, and these posterior nasal openings are lies in the posterior upper part of the hard palate, and these are divided by the midline vomer bone, which are known as choana. Then we will talk about the ala of the vomer bone. Now I already told you that ala of the vomer bone is the upper split area of the vomer bone, and you have to understand that this area is going to make a joint with the rostrum of sphenoid. Now this is very commonly asked question. It is again a most important multi-star question. Now you have this image in your mind that this green color bone is sphenoid. Now this is the body of sphenoid. You can see this in the midline. Now from the body there is a small projection is coming downward. Now this projection is known as rostrum. This is known as rostrum, which is a triangular spinous process facing downward. Now this triangular spine is making a joint with these two plates of the vomer bone, which are known as ala. So what is happening that there is a small projection coming from above. So this is a projection coming from above, and these are the two plates of your vomer bone. So in this way, what you are able to understand that a joint is formed here. Now this is known as wedge and groove joint. What is that? It is known as wedge and groove joint, and it is a type of a joint which is known as sphenoid. Now this is a type of the joint which is formed by the fitting of the crest of one bone. So which is the crest? Now this is the crest, which is a part of a sphenoid bone, into the groove. Now this is the groove which is formed by the splitting of the ala of vomer bone. So sometimes you have this question, what is the example of sphenoid? Answer is the joint between the ala and rostrum of sphenoid, and ala is a part of vomer bone. Clear? The inferior border, if you will see the vomer, so the inferior border of the vomer is making a joint with the upper part of this hard palate. That's why it is a midline bone, and it divides this posterior nasal opening into the right and left half. Now when you will see the ala related to that vomer bone, you are having one more important thing is known as vomerovaginal canal. Now here you have to understand there are two terms. That means it is a gap between the vomer bone and what is this? Now this is actually, you have to keep this thing in mind, it is a part of medial pterygoid plate. It is a part of medial pterygoid plate, and you know that medial pterygoid plate is a part of sphenoid bone. So it is a gap between the vaginal process of medial pterygoid plate of sphenoid bone and vomer bone. So it is formed by between the lateral border of the each ala. So first, which part of the vomer bone? Ala of the vomer bone, and where you will approach the ala on the lateral border. Now when you will see this inferior view of the skull, this is the lateral border of your ala. Clear? Now near this lateral border of the ala of the vomer bone and the vaginal process of medial pterygoid plate. Now this is the medial pterygoid plate. Now you can see this is the medial pterygoid plate, and this medial pterygoid plate is giving a projection towards the midline, and that projection which will come above this ala. Clear? So how you have to understand that this is the vomer bone, and this vomer bone is giving the two projections which are known as ala. Clear? So these are the two ala. This is the one side, this is the another side. Now here is a junction. You are able to appreciate a junction when you are having a dry bone, and you will find that here is a medial pterygoid plate. So this is the medial pterygoid plate. Now this pterygoid plate is giving a small projection. Now this projection is known as vaginal process of medial pterygoid plate. Now in between them you will find a opening. Now this is your canal. Now what is that canal is known as vomerovaginal canal. Clear? I hope it is clear to you that when you are having the dry skull, and if somebody will ask you locate the vomerovaginal canal, so you have to locate this vomerovaginal canal here along the lateral border of ala of the vomer bone, and it is formed in such a way where the medial pterygoid plates which are present here gives a small process towards the ala, and in between them a canal is formed. Now this canal is important because you have this question, it transmits the pharyngeal nerve and vessels. Clear? Now there is one more canal is known as palatinovaginal canal. Now again, when you will break this word, there are two parts. Now this vaginal word again comes from the same part, that is the vaginal process of your medial pterygoid plate. Now here the rather than vomer bone, now the bone has been changed. Now it is a palatinovaginal canal. So this palatinovaginal canal is formed between the palatine bone and the vaginal process of medial pterygoid plate. So the canal lies between the vaginal process of medial pterygoid plate and the sphenoidal process of palatine bone. Clear? Now where you will find the sphenoidal process of palatine bone? So this sphenoidal process is not visible in the norma basalis. The canal opens anteriorly into the posterior wall of Pterygopalatine fossa. Now my dear friends, where is the Pterygopalatine fossa? So when you will enter through infratemporal fossa, here deep to that you will find a small vertical fissure that is known as pterygomaxillary fissure. Through that pterygomaxillary fissure, if you will go deep, you will enter into the Pterygopalatine fossa. In that fossa, posteriorly here, you will have a opening of palatinovaginal canal, and this palatinovaginal canal is again formed between the vaginal process of medial pterygoid plate and the sphenoidal part of your this palatine bone. Clear? So you have to keep this thing in mind that palatinovaginal canal have a opening into the Pterygopalatine fossa, but this vomerovaginal canal is not having opening into the Pterygopalatine fossa. And when you will talk about the contents of this palatinovaginal canal, it also transmits the pharyngeal branches, but they are coming from the Pterygopalatine ganglia, which is a content of Pterygopalatine fossa. Now, when you will finish this middle portion of your this middle part, now we will move to this lateral sides of your middle portion of the norma basalis. Now in these areas, you are mainly having the sphenoid bone and the part of temporal bone. So when you will see this norma basalis, I am talking about these two lateral sides of the middle portion. Here you will have the contribution from the sphenoid bone and temporal bone. Now which areas of sphenoid bones are visible in this view? First is the pterygoid process, and second is the infratemporal surface of the greater wing of sphenoid. So where is these two areas? If you will try to mark these areas in this image, so this is your inferior surface of the greater wing of the sphenoid, and these are the two pterygoid processes. Now if you will see the temporal bone, now this is your temporal bone where you will have this external acoustic meatus, you will have the mandibular fossa, we will have the petrous part, we will have the tympanic part, and we will have the squamous part. So will discuss these two parts of sphenoid bone and these three areas of temporal bone in relation to the norma basalis. So, these are the three images. In this image, first you will see this is a suture line, and this suture line is between the sphenoid and temporal bone. Now, this is the anterior green part. Now, this is your sphenoid bone which you are able to see in this norma basalis. So, in this area, if you will remove this area of sphenoid bone, you are able to appreciate the pure area of temporal bone which is contributing in the norma basalis. Here we have removed the temporal bone, so you can see the area purely contributed in the norma basalis by the sphenoid bone. Clear? So, first we will see the pterygoid process of sphenoid bone in relation to the norma basalis. So, these are the few important points. The first point is that pterygoid process projects downward from the junction of the greater wing and the body of sphenoid. So, you know that when you are having this norma basalis, you will find these are the pterygoid processes which are extending downwards, and they lies behind the third molar tooth. So, this is the third molar tooth, and you will find these processes behind the third molar. And you know that every process consists of the two plate. So, whenever you are having this bone in your hand, you can see there are two plates are visible. This is known as medial pterygoid plate, this is known as lateral pterygoid plate, and these are present on both the sides. So, this is lateral plate and this is the medial plate of pterygoid process. These plates fused together anteriorly in upper part, and they encloses a V-shaped fossa is known as pterygoid fossa. So, here if you will see the fossa, where is the fossa? So, fossa is present here. Now, this gap, when you will see the two pterygoid plate, between the two pterygoid plate, you will find from the posterior side, you can pass your tip of the fingers inside this area, and that area is known as the fossa of pterygoid process, that is the pterygoid fossa. But anteriorly, these two plates are going and fuse with each other. The fused anterior surface form the posterior boundary of Pterygopalatine fossa. Now, this is again important to understand that Pterygopalatine fossa is a fossa which lies in front of the sphenoid bone. Clear? And in front of sphenoid bone, more particularly in front of the fused medial and lateral plates of pterygoid process. So, the fused anterior border of the two plates articulates medially with the perpendicular plate of palatine bone. Now, this is what you have to understand, that this is your palatine bone. Now, this is your horizontal processes of the palatine bone which are forming the posterior part of the hard palate. And when you will see the perpendicular plate, they are present in this part above. That means this is the shape of your palatine bone. Suppose I am drawing the palatine bone of one side and this is the palatine bone of other side. What you are able to understand that this is the horizontal process of the palatine bones which are coming here and they are forming the posterior part of the hard palate. But when you are talking about these perpendicular plates, the perpendicular plates are just right angle to this plate here, and this is the fused posterior margin of your pterygoid process. So, in between this area, you will have the perpendicular plate in the upper part which are articulating here with the fused anterior area of pterygoid process. And these plates are separated laterally. Laterally, you don't have any fusion, which I already told you, that is known as pterygomaxillary fissure. So, when you will see this bone, now in this bone, before going to this part, you have to understand that this is the anterior view of the sphenoid. Now, in this anterior view of the sphenoid, you can see that this is the plate which is going laterally and this is the plate which is going medially. Now, in upper part, you will find this is a fused area. It is a fused area of your palatine processes. Now, I am talking about the placement of your palatine bone. So, where is the placement of palatine bone? Now, palatine bone is the perpendicular plate of palatine bone will come here. It is making a joint here. Clear? Now this area is remain free and this is going to make the fissure that is known as pterygomaxillary fissure. Because this is the area of Pterygopalatine fossa and in this fossa you can enter from the lateral side. And medially this fossa is limited by this palatine bone and here you will have the nasal area. Clear? So this is the important thing to understand, that when we are talking about the placement of your palatine bones, the palatine bones are present along the medial margins of the fused processes and these are actually the perpendicular plates of palatine bone. Now, when you will have individual plate, now this plate is having the medial surface, lateral surface. This plate is having the medial surface and lateral surface. So, there are two processes and every process is having two surfaces, so there are total 4 surfaces. So, first is the lateral surface of lateral pterygoid plate. Now, when you will see the lateral surface of lateral pterygoid plate, that means we are talking here on this surface. Now, this lateral surface of lateral pterygoid plate is forming the wall of infratemporal fossa and it gives rise to the origin of the lower head of lateral pterygoid muscle. Now, when you will see the medial surface of lateral pterygoid plate, that means we are talking about in this area, then this area is forming the lateral wall of the pterygoid fossa. But obviously, the pterygoid fossa is present here between the two plates. So, this surface is forming the lateral wall and this surface is forming the medial wall of pterygoid fossa. So, the medial surface of lateral pterygoid plate form the lateral wall of pterygoid fossa and this surface also give origin to the medial pterygoid muscle and which had deep head of the muscle. So, here you are able to understand that the lateral pterygoid plate is having two muscles. One muscle is on here, now that muscle is the lateral pterygoid, one muscle is here, that is known as medial pterygoid. Now we will come to the medial plate. Medial plate is also having the lateral and medial surface. The lateral surface of medial plate is forming the medial boundary of the pterygoid fossa and this is related with a muscle. It will not give rise to origin. Please keep this thing in mind. Rather than it is related to the muscle. That means what will happen, if you will see this area, now we are talking about this surface, here you are having a muscle which is going downward along this surface. The tendon is going downward and that tendon which is related here is the tendon of tensor veli palati muscle. So, this is the question of your exam. Then you will have the medial surface of medial pterygoid plate and you have to keep this thing in mind, that this surface becomes the part of your posterior nasal aperture. So, it forms the lateral wall of posterior nasal aperture. Now, what are the features of the posterior border of medial plate? Now, here you can see the two images, one is the anterior and one is the posterior. Now, this is the anterior image of the sphenoid bone, this is the posterior image of sphenoid bone. Now, in this posterior image, you can see that this is the pterygoid fossa and this pterygoid fossa is present here between the two pterygoid plates. Now, this is the posterior border of your medial pterygoid plate. So, we will see what are the features present on this area of posterior border of medial pterygoid plate. Clear? So, the first feature is scaphoid fossa. Now, what is scaphoid fossa? When you will trace this posterior border and when you will reach in upper part of this border, you will realize there is a very small depression is present which is triangular in nature. So, here you will find a triangular depression along the upper border of your upper part of the posterior border of medial pterygoid plate. Now, this space provide origin to a muscle and that is known as tensor veli palati, the part of tensor veli palati. So, scaphoid fossa is the upper part, upper end of the posterior border of the medial plate and it divides to enclose a triangular depression is called as scaphoid fossa. So, this is the first question, locate the scaphoid fossa. So, if you will have this question in exam, locate the scaphoid fossa, you have to trace this posterior border of medial pterygoid plate and in upper part you will find a triangular depression. What is pterygoid humulus? Now, when you will start tracing this posterior border, on the lower end you will find a very sharp spine. Now this sharp spine at the lower end of this pterygoid plate is known as pterygoid hamulus, and this is the lower end of the posterior border of the medial plate, and this is actually provide the tendon of tensor veli palatii to wind around and change the direction. What does it means? That the muscle is going downward from here, which I just told you that the lateral surface of medial pterygoid plate related with the tensor veli palatii. So when the muscle fiber is going down, now this is going down and down and down, and at this point it will take a turn around the hamulus and change the direction at 90 degree. And the tensor veli palatii then comes towards the soft palate. Clear? So this is the question of your exam, that how the tensor veli palatii able to change its direction. Answer is with the help of this pterygoid hamulus. Now apart from that, on the posterior border you are having a one more important feature is known as processus tubarius. Now processus tubarius, the word tubarius comes from the tube, and which tube? Answer is auditory tube. So the area above the processus tubarius provide support to the auditory tube, medial end of auditory tube. So this projection present in the middle of the posterior border. So this is your posterior border. In this middle portion, sometimes you will find a small projection is known as processus tubarius, and the area above this provide support to the auditory tube. Now here in this image, what you can see is that this is the anterior view of the sphenoid bone. This is the posterior view of the sphenoid bone. Here you can see these are the middle cranial fossa. You can see the two foramens. These are known as foramen rotundum. Clear? These are the foramen rotundum. So this is the first thing. Now here you can see these are the medial and lateral pterygoid plates, and this is the inferior surface where you can see the spine which is going to form the joint with the vomer. Now this is what is the superior surface of the sphenoid. Now the important thing which you have to understand, that when you will see this bone anteriorly, and if I have to mark the area of Pterygopalatine fossa, so this is the area of Pterygopalatine fossa. Now in this area of Pterygopalatine fossa, you can see that there are openings present in the posterior wall of the fossa. Why I am saying posterior wall? Because in front of this bone, you still have the maxilla and palatine bone. Now when you are talking about the placement of the palatine bone comes here along the medial margin of these attached parts. So palatine bone perpendicular plate will come here, and when you will see the horizontal plate of the palatine bone, this will go like this. So this will become the horizontal bone, horizontal plate of the palatine bone, this will become the vertical plate of the palatine bone, and here you will have the fissure, and that fissure is known as the fissure between the maxilla and pterygoid process. So it is known as pterygomaxillary fissure, and this fossa is known as pterygopalatine fossa. And in this fossa you can see the opening of foramen rotundum, and this is the opening of anterior part of the your foramen lacerum through the you have the pterygoid canal. Clear? Now here you can see the placement which I had just told you about the articulation of the palatine bone and the sphenoid bone. So here you have to concentrate that how the perpendicular plate articulate with the sphenoid bone. So here you can see this is the perpendicular plate, this is the horizontal plate, and once this is going to make a joint, you can see that this plate is articulating here, and this is your become the hard palate, and this will become the perpendicular plate, and this is become the medial wall of pterygopalatine fossa. Clear? And when you will place the maxilla on the front, now the pterygopalatine fossa is no more visible, and from the lateral side the opening has been created, that is known as pterygomaxillary fissure. So whenever we are talking about the norma basalis, you have this confusion about these three bones, how they are articulating. So this has to be very clear to understand in your exam, that when you are having the articulation of the maxilla, palatine bone and sphenoid bone, you have to first this thing in mind that the palatine bone and the maxilla lies anterior to the sphenoid bone. Second thing is that the perpendicular plate of this palatine bone lies on the inner side of the fused part of pterygoid process, and once it will lies on the inner side of the process, the foramens of these two foramens become on the outer part and they enclose inside a gap is known as pterygopalatine fossa. Clear? So, this is what is very important concept to understand. Now, the next thing is that the infratemporal surface of the greater wing of sphenoid. So, initially I told you that when we are talking about the norma basalis, we will see two things. One is the pterygoid process and second thing is the infratemporal surface of the greater wing. So, this surface is pentagonal and it forms the roof of the infratemporal fossa, and when you will have the pentagonal word, you will have the 5 margins: anterior, anterolateral, anteromedial, posterolateral and posteromedial. So, this is your infratemporal surface. Now, this infratemporal surface, if you will draw all the margins, you can see I have already made a pentagon. Now, what are the margins? Now, this is the anterior margin, this is anterolateral margin, this is anteromedial margin, and these are the two posterior margin, posterolateral and posteromedial margins. Clear? So, let us discuss these 5 margins one by one. So, the first is the anterior margin. Now, this anterior margin forms the posterior border of infraorbital fissure. So, this is the posteriorly you will have the anterior margin of this is the anterior margin. So, this is the anterior margin of your pentagon, and this anterior margin is going to form the border of infraorbital fissure that we will discuss in the coming slide. Then you will have anterolateral margin. Now, this margin is very important, because when you will have the dry skull in your hand, you can very well appreciate some projections, and this is the junction of this lateral part of the greater wing and this infratemporal part of the greater wing, and this is known as the crest. Now, this crest is having a very important feature because it will give rise to the origin of the upper part of lateral pterygoid muscle. So, this is your infratemporal crest. Then you will have anteromedial margin that continue with the pterygoid process and the body. So, this is your anteromedial margin. Now, this is the pterygoid process. So, this anteromedial margin continue here with this body and the pterygoid process. So, this is your anterior margin, this is anterolateral margin, and this is your anteromedial margin. Now, here I am talking about the anterior margin. So, this is your infraorbital fissure. Now, this is the anterior margin. So, here you will have the anterior margin which is here, Now, this anterior margin is making the border of your fissure which is known as infraorbital fissure. Now, what are the two posterior boundaries? Posterolateral and posteromedial. Now, in this image, if you will see the norma basalis, the posterolateral articulate with the squamous part of temporal bone. So, this is your squamous part of temporal bone. Clear? Now, in this squamous part, you can see that this is the squamous part of temporal bone which is articulating here with the sphenoid bone. So, this line of the joint is showing the posterolateral margin. Now, where is the posteromedial margin? Now, this is the posteromedial margin. Now, this posteromedial margin is articulating with the petrous part of the temporal bone. So, this is the petrous part of temporal bone. Clear? So, this is your anterolateral margin, this is your posterolateral margin, and this is your posteromedial margin of your greater wing of sphenoid. Now, this is again very important question in your exam. Where is the spine of sphenoid? So, spine of sphenoid is present at the junction of the posterolateral and posteromedial margin. So, where is the posterolateral margin? So, this is the posterolateral margin. Where is the posteromedial margin? This is the posteromedial margin. At this point of the junction, you will have a small projection, and this projection is known as the spine of sphenoid, and near the spine you are having a foramen is known as foramen spinosum. Now, this spine itself having a very important relation. On the lateral side there is a nerve, on the medial side there is a nerve. So you have this question, which nerve lies on medial side of the spine? Answer is cauda tympani. And which nerve lies lateral to the spine of sphenoid? Answer is auriculotemporal nerve. Then the next come is that in this area, when you will see the posteromedial and margin and scaphoid area, now this is your scaphoid area, this is the medial plate, and above the medial plate you will have the scaphoid fossa. Now from the scaphoid fossa, from this scaphoid fossa till this posterior margin, in this area you are having the 4 foramina. What are these 4 foramina? Foramen ovale, foramen spinosum, foramen basalis and cannaliculus innominatus. Now out of these 4, these 2 are may be present, may not be present, but foramen ovale and spinosum are constant findings. So let's discuss first foramen ovale. Now foramen ovale is the largest foramen which is present here, and this foramen allow the passage of 4 structure, and how to remember them? Answer is male, M-A-L-E. Now M stand for the mandibular nerve, A stand for the artery, that is accessory meningeal artery, L stand for the lesser petrosal nerve, and E stand for the imaginary vein. Clear? So these are the 4 structures which are transmitted through this foramen. The next is the foramen spinosum, which lies just posterior to the foramen ovale near the spine of sphenoid, and through this foramen spinosum you are having only the 2 structure, middle meningeal artery, which enters inside the cranial cavity along with the nerve supply of the meninges, that is known as nervus spinosus. Then you will have foramen basalis. Now foramen basalis is a foramen which is also known as foramen for the imaginary vein. So it is known as imaginary sphenoidal foramen or sphenoidal imaginary foramen. This foramen, if present, situated between the foramen ovale and scaphoid fossa. So where is the foramen ovale? So this is the foramen ovale. Where is the scaphoid fossa? This is the scaphoid fossa. So if this foramen is present, it lies anterior to the foramen ovale. So this is the place for the foramen of basalis. Now this foramen basalis internally opens into the cavernous sinus, and it allows passage for imaginary vein. Then the next is foramen innominatus. It is situated between the foramen ovale and foramen spinosum, and if this foramen is present, then it allows passage for lesser petrosal nerve. So in short, you have to understand that there is a foramen ovale, and behind that you have foramen spinosum. This is a constant finding, and through this foramen ovale you are having 4 structure. What these 4 structure I told you? M-A-L-E. M stand for mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and imaginary vein. And this is the foramen spinosum, and through the foramen spinosum you are having the 2 structure, middle meningeal artery and nervus spinosus. Now there are 2 more foramen. One foramen is present anterior to the foramen ovale, and one foramen is in between these 2. Clear? Now in between the spinosum and ovale, this foramen is known as cannaliculus innominatus, and this will allow the exit of lesser petrosal nerve, and in this condition this L will not come out from foramen ovale. In the same way, anteriorly you will have this foramen basalis, and this foramen basalis allow passage for imaginary vein, and in this condition this imaginary vein will not come out from foramen ovale. So there are 4 foramens, and 2 are may be present, may not be present, and if these 2 will present, then the contents of foramen ovale divide into the 3 part, imaginary vein here, lesser petrosal nerve here, and remaining 2 structure through the foramen ovale. So now this is the norma basalis, where you can appreciate this is the foramen ovale. Behind that, this is foramen spinosum, this is the spine of sphenoid. Now you may have one foramen anterior to this, and you may have one foramen in between this. Now this foramen is foramen basalis, and this is cannaliculus innominatus. Now we will talk about the infratemporal surface of greater wing, where you will have one more important thing is sulcus tubae. Now what is sulcus tubae? Again the tube stands for the auditory tube, and this sulcus is to provide support, or it lodges the part of your auditory tube. So it is a groove between the posteromedial margin of the greater wing of sphenoid and petrous part of the temporal bone. So, in this Norma basalis, you have to first find out this is the posteromedial margin of your greater wing, and this is the triangular petrous part of temporal bone. Clear? Now, in this area between these two, if you will mark the area, now we are talking about this area. Now, in this area you are having a groove which is very shallow groove, and this shallow groove is known as sulcus tubi, and this sulcus tubi lodges the cartilaginous part of the auditory tube. Posteriorly, the groove leads to the bony part of the auditory tube. So, posteriorly the tube will enter inside where you will have the bony area. Now, we will talk about the temporal bone. So, when you are seeing the Norma basalis, you will have the three parts of the temporal bone, as I already told you. So, first we are talking about the petrous part of the temporal bone. Now, when you will see the Norma basalis, here you can see this is the green bone which is visible now is the temporal bone, and in this green bone, when you will see a triangular projection. Now, this triangular projection is basically the petrous part of the temporal bone. So, it is a triangular in shape and the apex directed forward and medially. It lies between the greater wing of sphenoid and base occiput. So, this is the greater wing of sphenoid, and this part is known as base occiput of occipital bone. Now, it has a quadrilateral area near the near the apex, and that area provide origin to the muscle is known as levator velli palati. So, where is that area? Now, this we are talking about this upper quadrilateral part of the petrous part of the temporal bone. Now, from this surface, you will have the origin of a muscle is known as levator velli palati, and behind this area, you have the opening of carotid canal. So, this is the opening of carotid canal. Through this carotid canal, the internal carotid artery enters inside the cranial cavity. Then, there is a very important foramen is visible on the Norma basalis is known as foramen lacerum, and it is located between the sphenoid bone and the petrous part of the temporal bone. So, again this is the anterior margin of the petrous part of the temporal bone, and this is the sphenoid bone. You can see this is the sphenoid bone. So, in between these areas you are having a irregular gap. Now, this irregular gap is known as foramen lacerum. Clear? So, this is the foramen lacerum, and this foramen lacerum has opening of the carotid canal and pterygoid canal. Now, this is very important question for your exam, that there is a foramen and this foramen further is having two opening. One is pterygoid canal, one is carotid canal. So, where is the carotid canal? This is the carotid canal. This carotid canal is making a loop inside the bone, and when you will see the loop, this loop will go like this. So, this canal is having the opening in the upper part of this foramen lacerum. So, when you will make this loop of the carotid canal like this, so this carotid canal is having the opening in the posterior part of your foramen lacerum. Clear? In the same way, if you will have the second pterygoid canal, so this pterygoid canal is also having an opening which starts from here, and this pterygoid canal further opens into the fossa which is present here is known as Pterygopalatine fossa. So, this canal provide entry to a nerve is known as nerve to pterygoid canal. So, in this foramen lacerum you are having posteriorly continuity with the carotid canal, and anteriorly you are having a small opening here, that is the opening of canal of pterygoid or pterygoid canal. So, that is why the internal carotid artery traverses the upper part of the foramen lacerum. The median nerve, which I told you is known as nerve to pterygoid canal, passes through its anterior end and it ultimately reaches to the Pterygopalatine fossa. Now, this foramen per se allow passage to two structure. One is the emissary vein and second is the meningeal branch of your ascending pharyngeal artery. So, one vein and one artery are passing from outside to inside and inside to outside. So, artery is going from outside to inside, vein is coming down. That vein is emissary vein and the artery is the meningeal branch of ascending pharyngeal artery. Otherwise, this foramen is remain closed. Then you will have the second part of the temporal bone is known as tympanic part. This tympanic part is actually more commonly known as tympanic plate of your temporal bone. Now, when you will see the temporal bone individually, you will find that this triangular plate is visible in the Norma basalis. Now, this triangular plate is actually known as tympanic part of temporal bone, and this triangular plate lies in the angle between the petrous part and squamous part. So where is the petrous part? So this is the petrous part, which is partially visible here, and the remaining is the squamous part. So this plate lies between the petrous part and your squamous part. Now when you will see the tympanic plate, you will realize that the apex of this plate is directed to close to the spine of a sphenoid. So when you will see this apex, you will have the anteriorly placed sphenoid bone, and near this you will have the spine of a sphenoid. Now which are the other important features of this tympanic part? The first feature is that when you will talk about the base is also known as the lateral border. So in this image, where is the base? So this is the base and this is the triangle. Clear? Now this base is having a curve. You can see that this is a curve in the base. Now because of this curve, this base is going to form different wall of external acoustic meatus, which is present here. Apart from that, when you will see this anterior surface of the tympanic plate, it is become the part of your mandibular fossa. So this whole is the mandibular fossa, and this mandibular fossa, if you will see the norma basalis, is having a fissure. Now this is a fissure, or you can say a junction is seen in this fossa. Now what is the name of this junction? That I will tell you in the coming part of this lecture. But you have to first understand that this whole fossa is having the tympanic plate behind this fissure. Clear? The posterior surface is facing towards external acoustic meatus. So this is the posterior surface of the plate, which is making inner side of your external acoustic meatus, and this tympanic plate is forming the different wall of external acoustic meatus. Which wall? Anterior wall, floor, and lower part of posterior wall. Why? Because it is having a curvature. So here in this image, you can see that this is your external acoustic meatus. So this is forming the anterior wall, this is forming the floor, and this is forming the lower part of the posterior wall. So this curvature of the tympanic plate is contributing in the three walls of external acoustic meatus: anterior wall, floor, and posterior part of this lower area of posterior wall. Clear? Now the tympanic plate also form the anterolateral part, or you can say it also covers the base of your styloid process. So this is the base of styloid process, which actually starts very high, but here it is not visible because it is covered by this tympanic plate. Internally, when you will see the tympanic plate, it fused with the petrous part. So if you will see this fissure, which I just told you, now through this fissure, this curved area is going in deep, and in deep area it will go and merge with the petrous part of temporal bone. So here in this norma basalis, if you will put this bone in the norma basalis, what you are able to understand that this is your fissure which I am talking about. This fissure divides this mandibular fossa in the two part, and the posterior part of the mandibular fossa is formed by the tympanic plate. Clear? So this tympanic plate is very important because so many times you have this question in exam that you have the marking here and you have the question, what is this area? So this is the tympanic part of temporal bone. Now the other part is the squamous part of the temporal bone. Now when you will have the squamous part of the temporal bone in norma basalis, a very small portion is visible in the norma basalis. And what are the features of squamous part visible in the norma basalis? First is the anterior part of the mandibular fossa. Now this is the most important question. I just told you that this articular fossa, or the area for the head of mandible, is divided into the two part by a fissure. Now anterior to this fissure, this whole area is the part of a squamous part of temporal bone. So this whole is actually the squamous part. But when we will talk about the norma basalis, we are not talking about then this part which is visible in norma lateralis. But you have to understand this concept in your mind that this base, when you will see the base, in this base the mandibular fossa is divided into the two part by a fissure. Now anterior to the fissure, this mandibular fossa is formed by which bone? Answer is squamous part. Behind the fissure, this area is formed by which bone? Answer is tympanic plate or tympanic part of the temporal bone. Now, this is the first thing which is visible in the Norma basalis. Second thing is that there is a articular tubercle. Now, this is the articular tubercle, and this articular tubercle is again the feature of squamous part of the temporal bone. And it is continue anteriorly with the anterior root. So, this is the anterior root of the zygoma. Then there is a small posterolateral part of the roof of infratemporal fossa. So, now this infratemporal fossa is where? Now, this is the infratemporal fossa. So, this small infratemporal part is also visible. But majorly, this first line is very important for your exam, because so many times you have this question that mandibular fossa is made up of which parts of the temporal bone. So, mandibular fossa is made up of squamous part in front of the fissure and tympanic part behind the fissure. Now, this is the answer of that fissure, and that fissure is actually known as squamotympanic fissure. So, I just told you that this whole articular area is divided by a fissure into the two parts. The anterior part is formed by squamous, posterior part is formed by tympanic. So, what is the name of the fissure? Answer is squamotympanic fissure. So, it marks the junction of squamous part and tympanic part, but the question is where this part is present. Answer is in mandibular fossa. So, this is your mandibular fossa. In this fossa, this is the line, and this line is known as squamotympanic fissure. Anterior to that you have squamous part, posterior to that you have tympanic part. But my dear students, this squamotympanic fissure is further divided into the two parts. How? Because I just told you that this tympanic plate is going at this point, it is going deep, and when it will go deep, it is making a joint with the petrous part of the temporal bone. So, petrous part is not visible here, but it is present, and to see this you have to look for the superior view where you will have the floor of cranial cavity. In the floor of cranial cavity, in upper to this you will find the petrous part of temporal bone. So, that petrous part will give a small projection, and then the projection will come between the squamous part and tympanic part, and this is the petrous part which is coming from above, and because of this reason this fissure is now divided into the two parts. One is the area between the petrous and squamous, another is between the petrous and tympanic. So, let us see this. So, the squamotympanic fissure marks the junction of the squamous and tympanic part into the mandibular fossa, and I just told you that there is a petrous part of the temporal bone, and that is known as tegmen tympani. Now, this tegmen tympani is not a feature of Norma basalis. If you want to see the tegmen tympani, you have to see this cranial cavity. Now, this is the view inside the cranial cavity, and inside the cranial cavity, this part is known as tegmen tympani. Clear? Now, this tegmen tympani is also the part of the petrous part of the temporal bone, which is present in the middle cranial fossa. It is not visible through the Norma basalis. Now, this tegmen tympani is sending a small projection which is known as edge, and this edge is dividing the squamotympanic in two parts. I just told you this is squamous part, this is tympanic part, and now this is the petrous part is coming. So, this is squamous, this is petrous, this is tympanic. So, what is the name of this anterior fissure? It is known as petrosquamous fissure. Now, what is the name of the posterior fissure? It is known as petrotympanic fissure. But what is the overall name of this fissure? Squamotympanic fissure. Squamotympanic fissure divided by petrous part into the petrosquamous and petrotympanic fissure. So, now at the end of this session, you have this, suppose in exam Norma basalis, what are the structures you have to mark? So, we have read this is what? This is the incisive canal or the fossa. This is what? This is the cruciform suture. This is the greater palatine foramen. This is the lesser palatine foramen. This is the pterygoid hamulus. This is the posterior margin of medial pterygoid plate. This is the posterior margin of lateral pterygoid plate. This is the scaphoid fossa. This is the foramen ovale. This is the foramen spinosum. Clear? Now, this is the carotid canal. This is external acoustic meatus. This is mandibular fossa, where you have this fissure, squamotympanic fissure. this is the tympanic plate, this is the squamous part, this is the articular eminence or articular tubercle of the zygomatic arch. This is the infratemporal surface of the greater wing of the sphenoid. Here you will have the infratemporal crest on the greater wing of the sphenoid. Now, here you will have the foramen lacerum, which is near this apex of your petrous part of the temporal bone. So, this is the petrous part of the temporal bone, which is triangular. Now, this is your vomer bone. This is posterior nasal spine. These are the ala of the vomer bone. This is the junction between the sphenoid and the anterior part of the basilar part of occipital bone. This is the pharyngeal tubercle area. This is the anterior margin of foramen magnum. Clear? So, this much of the markings which you should know till now after seeing my first and second part of Norma Basalis. So, this is all for the session. Thank you.